Welcome to the Dentist News Network. I'm Scott Drake. Today we begin a series of videos about patients who suffer from chronic headaches and chronic migraines. My guests are Dr. Joe Harris from Harris Dental in Phoenix. Dr. Harris, welcome.
Hello, Scott.
And Dr. Rick Amy with Truedenta. Rick, thanks for joining us.
Thank you, Scott.
So Rick, we'll begin with you. I guess it's safe to say that there has now been an increase in patients who present themselves with chronic headaches or chronic migraines.
Yeah, absolutely. I think over the last 5 years, we've seen just a steadily increase to where we really have an epidemic here in the United States. They say that there's 40 to 45 million daily migraine sufferers, those people that are suffering at least 4 to 5 days a week with a headache or a migraine. And there's not a whole lot for a lot of these patients to do, so as far as treatment-wise. And so some of them are searching for new avenues and ways that they can get healthy in a natural fashion.
So Rick, can you talk about what the traditional treatments have been in the past?
Well, I think traditionally, once they start to become bad enough that the over-the-counter medications are not working, usually they seek out their general practitioner, their medical doctor, and at that point they usually give them muscle relaxers or heavier duty pain medications, which are great to help them get through it, but we really know that doesn't get to the source of the problem. Now there's different signs and symptoms that might be accompanied with this, such as if you had ringing in the ear or fullness in the ear, then they might send you out to an ENT. An ENT would typically do a CAT scan to rule in or rule out any major organic pathologies such as cancers or tumors and things of that nature. Now, if they thought that it was more muscle related or joint related, they'd probably send you off to a physical therapist or to a massage therapist, and they would work on the muscles and the joints, which is really only 1/3 of the problem. Other times they send you off to a neurologist. The neurologist will now do MRIs. Those MRIs are usually negative, which is a good sign, again, ruling out cancers and tumors and things of that nature. And then you get into the heavier duty drugs, the ones like the Imitrex and things of this nature. And those are usually good in the beginning if they can control them. But we know that these medications over time start to give you the headaches you're trying to get rid of. They call that rebound headaches. And there's a lot in the literature explaining how this medication overuse really happens, and that it starts out really good, but as you take them, it gets rid of the headache, but then they start to come back really, really fast and more frequent. So we know that that's not good. So we know between the combination of the medications and just doing the physical therapy and treating the muscles, that wasn't enough. And with this new research, we really understand there's a dental component that must be addressed with all these patients.
So Dr. Harris, what are you seeing now from your patients?
Well, for many years, we saw people with headaches and didn't really know what to do. We would refer them to their physician for care. We've seen more and more and more. Some of these are tied in or related to what we call TMJ or TMD, temporomandibular joint dysfunction. And so in those cases, we've treated those problems with splints and other therapy. But until we connected with Dr. Amy and some of the philosophies that he's brought forth and some of the modalities to treat these, we just didn't have an answer. And I'll be honest, I think we probably just overlooked a lot of things, assuming that's the way it is for people, that people have headaches. As we begin to hone in on it, and we first did this with our own team, we started talking about it, and I discovered that 2/3 of my own team had such pain that they're seeing a chiropractor or a massage therapist on a regular basis just to work out the stresses and strains of life, of work, and things like that. And so I took a big interest in it, and we've found that many of our patients now have these problems all the time. And for a lot of them, they've been through all these other options in terms of care with medications or massage or whatever, and some of them just give up. And some of them get some relief, but not all the relief. And so with that in mind, when we saw that, we were very interested in trying the new treatment. And the results have been pretty amazing. One of my own dental hygienists was the very first person we treated. And after she had been through a little bit of treatment, she came to me and said, I can't believe what a difference this has made. And where my life was, her life was really in shambles in many ways. And she tied it all back into the stress and strain and chronic pain that she had from these episodes.
It seems to indicate that part of the treatment is to determine if a patient is out of balance. Can you talk about how you find that out?
Well, traditionally, through the medical, usually what we do is we take the guidelines for pain and disability written by the American Medical Association. And they really look at things such as range of motion, or how far you can move, and they look at strengths and then muscle trigger points to really determine any disabilities. So the really beautiful thing is that Dr. Harris for years has been using a device called a digital force analysis that can actually take a movie of your bite and really determine how your muscles are working, and if they're working in harmony. It'll tell you the balance from left to right side. It'll also tell you the force on each individual teeth coming together. And when we see red flags or out of balance, it's usually a sign that there's going to be some dental force imbalance, and that's really one of the best tools that we've had, and that's really great new technology.
Dr. Harris, can you talk about how you integrate the treatments into your practice?
We started out kind of slow because I wanted to find out if it worked, and again, we started with our own teammates, and the results were so dramatic, and so we've really ramped it up. We have quite a number of people in treatment now, and the results have been nearly all of what we hoped for. We began with screening, just asking people if they have headaches, and as we find that out, we find more about the history, and nearly always there's a history, and that's a really intriguing part for me, that so many of these people who have migraines have a common background or a common event somewhere in their life. It isn't that their chemistry is bad or that the economy is bad or other things. There's very often a traumatic event sometime in their life, either an accident or a sports injury or a fall that was one of the triggers. And as we've identified these things, and we can put together a treatment plan, which is really straightforward, doesn't involve drugs for the most part, and doesn't take that long to get them on a path where they're seeing results.
Rick, is the end goal of this to eventually get the patient completely off of medication?
Yes, most people don't want to be on the drugs, but the drugs are very, very necessary in order for them to get through their life and activities of daily living. So our goal is not to change that in the beginning. In fact, when we start getting to the source of the problem, sometimes we have to slowly, or not slowly, but for short periods of time, increase their anti-inflammatories and pain medications because we're actually getting to the source. But over time, as the body heals and that inflammation goes down, the need for inflammatory medications is decreased. At that particular point, we'll also look with their physician and work together with them, and they'll try to do the regimen to slowly wean them off any drugs. We also do things that take and help to replace serotonin in the brain, which most of these patients that are on non-steroidal anti-inflammatory and all the migraines patients have this decrease in serotonin. So once we get that brain chemistry to start working better, which usually takes a couple months, again, we're going to consult with their physicians and we're going to slowly wean them off it if possible. And that's really our goal.
Dr. Harris, in closing, can you talk about some patient experiences?
We can get into a discussion of the exact treatment modalities, and that might be another discussion. What we have seen uniformly is that the patients are very comfortable during the therapy. In the initial parts of the therapy, sometimes they have a little spike or a rebound triggering a headache in the initial treatment, but in a very short time we're seeing people feeling better. All the indicators that Dr. Amy talked about, the range of motion, the comfort, the muscle tightness, all of those things show improvement. And it isn't one big jump, it's an incremental improvement, but as with any healing, muscles take time to heal and the joints and ligaments take longer. But it has been a pretty successful event. We've had a couple of people who, through the course of ruling out the things that we did, found that there were other things involved. One of our patients has spinal stenosis, which is not something we can deal with, but she's receiving the care and therapy for that through her physicians.
I'm Scott Drake. You're watching the Dentist News Network.